Good afternoon, Dr. McHenry coming to you on Wednesday, November 4th, the day after the election. I'm making a video to give you something to think about other than the election. So let's talk COVID. The news has been doing nothing but saying surge, 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 which is a scary term, surging. Yes, we have seen an increase in the number of cases. There is an increase in hospitalization and ICU beds, but it's a slow increase. Our low point was since our big peaks in July. July was when we had the most number of cases, the most ICU beds, the most hospitalizations, and then we hit a low in September, early September. Since that time, there's been a very slow trend kind of creeping, a little steepening of that recently, mostly due to the young people being back out there, the young kids being back in school. You're obviously going to see more cases. And I want to remind you that when they say cases, that means a positive test. That does not mean somebody died, that does not mean somebody's hospitalized, but it means somebody contracted the virus. That's it. The majority of my patients that I've seen with the COVID virus have had very mild symptoms. I have a couple of people who have had prolonged symptoms, which is not very enjoyable. They are a very, very low percentage. Anybody 55 and under is going to do exceedingly well from COVID. The chance of severe complications or death under the age of 55 is very, very small. Those who are 65 and over, the risk of complications and hospitalization and death start to increase. My patients who are over 65 have been very diligent so far at not contracting the virus. That is what we need to continue to do, is protect those more at risk. We need to continue to keep our distance. We need to continue to use masks and wash hands and stay somewhat put if you're in that high-risk group. Don't go out and eat in restaurants if you're in the high-risk group. Every decade beyond 65, 75, 85, etc., increases your risk greater. So the older age is the higher risk group. The real split comes at about 55. It starts to go up, I don't want to say exponentially, but at a rate that is significant enough to pay attention to. So again, I believe in opening our state. I believe in safety. I believe in protocols to mitigate the spread and the risk and protect those that are at highest risk. If we continue to do that, then we shouldn't see a spike as we did in July with kids being home after school, with kids coming home from college towards Thanksgiving. We're going to have to be more diligent, be a little more careful to slow the spread and keep that curve from peaking as it did in July. Our hospitals currently in the valley are doing fine. The state is seeing an increase. I don't, again, like the word surge. We are testing more. We are seeing more positives because of more testing, but also because there's been some more community spread. So I hope that explains it to you all. As far as the flu comes around in the fall. We've had quite a run on influenza vaccines. We already used our entire allotment from last year. We ordered twice since then, and we've already used those up. We have another order on waiting on shipment currently. If you have access to a CVS or a Walgreens or a grocery store pharmacy, please get your flu shot there. More people are getting flu shots this year than last year to not mix the symptoms of flu and COVID and not know which it is. So again, masks, social distancing, washing hands does decrease the spread of COVID. So continuing that, mitigating your exposures, mitigating your risks, especially if you're in the high-risk category, is the plan. If you have specific questions regarding your health, your risks, I'm happy to have a phone call conversation about it to spell out in a little more detail your risks. Again, the site that I like to use for the numbers is biodesign.asu.edu/research/ critical trends in COVID-19. I hope that you find this helpful and have an excellent Wednesday, and I look forward to talking to you all soon. Bye.